I am Dr. Monika Singla. I am a DM neurologist. I just wanted to talk briefly about stroke. Stroke, as we know that it is a very common entity. Worldwide, it is third leading cause of death and morbidity. So, we have to be very much aware about stroke. What is stroke? What are the risk factors? And how do we treat it? So, what is stroke? Stroke, it is a vascular event because of sudden cessation of blood supply. It can be because of the occlusion of the blood vessel in the brain or because of brain hemorrhage. So, what happens in stroke? If there is stroke of one side of the brain, there will be weakness on the other side, and there can be facial deviation, there can be slurring of the speech as well as inability to speak. So, what is an easy way to learn? Because as a doctor, I know it is stroke, but as a layman, how do we know that it is stroke? It's very easy to learn the mnemonic FAST. FAST means F for face. If you feel there is any facial drooping or deviation. A means arm. We can tell the person to stretch the arms. If you feel there is weakness of one arm or one side of the body, then S is S for speech. If there is any slurring of speech or any difficulty in speaking. If all these three components are present, then we should know it is stroke. There is T stands for time. Then we need to know that we have a very short time. Time is brain. We need to act very fast. So, if somebody suffers from stroke, means acute stroke, we should rush the patient immediately to some nearby good tertiary care center in a hospital where you have the availability of a neurologist or good emergency physicians who can deal with stroke. If there is ischemic stroke, we know that we have a facility of availability of TPA. What is TPA? TPA means it is tissue plasminogen activator. It helps in lysing the clot. If person is taken to the hospital within a time window period of 4.5 hours, then we can lyse the clot, person can be saved. If we suffer from this morbidity of weakness of one side and person is hemiplegic throughout, that person can be saved from that weakness and you can live a normal life. You can earn for your family. So, we should understand the importance of that time, because if this time period is gone, then probably we cannot avail this facility of TPA. Secondly, every minute so many millions of neurons are dying. So, we have to understand that we have to restore this blood supply by giving this TPA injection. And so, we should take this person to the hospital immediately. So, who are the patients who suffer from stroke? We need to understand that what are the risk factors? Persons who are elderly means more than 5th to 6th decade of life, who are diabetics, hypertensives, having high cholesterol levels, persons who are obese, who are having sedentary lifestyle, means we do not exercise, who are smokers, taking heavy amount of alcohol or other drug abuse, persons with heart disease or some irregular heart rhythm, there are chances of getting stroke in these patients. Hypertension is the most common of punctures. So, can we prevent stroke? I think, as I am telling, these are the risk factors. If we control our risk factors like diabetes, we have a good glycemic control and we are taking regular medications for our sugar, for blood pressure, then we can control stroke. As well as if we take a good diet which is healthy in fruits, vegetables and low cholesterol, we should avoid pizzas, burgers, so we can avoid stroke. We should try to reduce our weight, live an active life with good exercise and daily walk at least for 30 minutes. As well as we should, if person is suffering from the heart disease, we should consult our doctor and take regular medications. If we control all these risk factors, then we can control stroke. But still, if somebody suffers from stroke in spite of all these things, then we should consult our doctor and take the patient immediately to the hospital. Another question which people ask commonly, do women suffer from stroke? Yes, probably. Women suffer from stroke more than men in the later age group. There was a myth that only men suffer from stroke, but no, it's not like that. Recent studies have shown that women suffer from stroke more than men in their later age, after 5th to 6th decade of life. There are few reasons why women suffer. Probably in India, in the rural areas, women do not take treatment for their hypertension, diabetes. They do not avail the facility of the medical access, and they do not go to the hospitals. So that's why they are prone to getting stroke. Second thing, in the later age group, they are having post-menopausal symptoms as well as the changes in the hormonal levels. There is chance of getting thickened blood and getting stroke. Third thing is, because of the longevity of life, women have more increased life expectancy as compared to men. So that is one of the reasons to get stroke in women. And another reason is they are suffering more from depression as compared to men. So we should take care of the women in the family. If they are suffering from any diabetes, hypertension risk factors, we should try to control these risk factors and make them aware that they should also take care of their health and doing regular exercise and lifestyle modification. So we need to understand our brain, that brain is the most important part of the body. If our brain works well, then we can work well in our life and we can live a productive life. So we should take care of all these things, and we should take care of our near and dear ones and our neighbors, our family members, and always guide them regarding these risk factors and stroke prevention. If anybody suffers from stroke, we should make them aware that this facility is available in the hospitals, and we should take the person to the hospital immediately and avail this facility of TPA. Thank you.